Hey guys, welcome back to my channel. This is Dr. V, Sonu to OB-GYN, who's an OB-GYN IMG specialist preparing for the RCPSC exams. So let's do some flashcards today and let's choose a topic. Should be advanced obstetric ultrasound and fetal diagnosis. Let's see what we study today. Okay, so what would be the minimum crown rump length threshold for diagnosing non-viability if no fetal heart activity is seen? So since I'm a sonographer as well and I do OB datings every day, so I think the answer should be 7 millimeters. Great. So the cutoff to declare is 7 millimeters. If the CRL is 7 millimeters and it still doesn't have a heart rate, it should be called a non-viable pregnancy. But if the CRL is less than 7 millimeters without a heart activity, a repeat scan in 7 to 10 days is required to avoid false positive diagnosis of pregnancy failure. What is the minimum mean sac diameter for diagnosing non-viability in a gestational sac without an embryo? 25 millimeters? Yes, if a gestational sac is equal to and more than 25 millimeters with no embryo, it is definitive for non-viability. But if the mean sac diameter is less than 25 millimeters, follow-up ultrasound in 7 to 10 days is mandatory. If an initial ultrasound shows a gestational sac without a yolk sac, what interval ensures definitive diagnosis of non-viability? So here we need to keep three things in mind. There is a gestational sac, but there is no yolk sac, so that means it will take a little more time. So you should wait longer to bring them back. So the answer will be 14 days or equal to or more than 2 weeks. What finding defines the Mickey Mouse sign in the first trimester ultrasound? I think it's the yolk sac amnion. It's acrania encephaly sequence. It refers to the appearance of the fetal brain, in which the ears are protruding into amniotic fluid because there is no cranial vault. This is reliably detectable at 11 to 14 week scan. So what is the earliest gestational age at which omphalocele can be reliably diagnosed? After 12 weeks, because before 11 to 12 weeks, the presence of bowel in the umbilical cord base may represent physiologic midgut herniation. So persistence of herniation beyond 12 weeks or if the CRL is more than 45 millimeters is pathologic. What are the three primary ultrasound criteria for cesarean scar pregnancy? Okay, so the first one will be empty uterine cavity and empty cervical canal. Second is gestational sac in the lower uterine segment scar. Number 3 is thin or absent myometrium between the sac and the bladder. So what is the most differentiating cesarean scar pregnancy from inevitable miscarriage? Could be the pregnancy is low, but how would be able to differentiate from the inevitable miscarriage from the cesarean scar pregnancy? So it involves observing the lack of sliding sign on the transvaginal ultrasound. What myometrial mantle thickness suggests an interstitial or corneal ectopic pregnancy? Less than 5 millimeters. If the gestational sac is central, it has to be more than 5 millimeters away, but if it is located eccentric or superior with less than 5 millimeters of surrounding myometrium, it at its most lateral aspect. It is also typically more than 1 centimeter from the lateral edge of the endometrial cavity. So we should remember, if we feel the gestational sac is more on the lateral side, always measure the distance between the serosa to the gestational sac. Appropriate caliper placement for the nuchal translucency measurement. Very important question. The caliper should be placed from inner borders of the echo, so inner to inner, and it should be taken at the widest part of the translucency in a neutral mid-sagittal plane. And also another thing, if there's a loop of cord around the neck, we have to measure one before that cord and one post the cord loop. Okay, so chorionic villus sampling is generally done between 10 to 12 weeks of gestation. Why it should be avoided before the 10 weeks of gestation? So the risk of the limb reduction defects. Any procedures that are performed before the 10 weeks, they are associated with oromandibular or limb hypogenesis. So that's why the ideal time for the chorionic villus sampling is between 10 weeks to 13 and 6 weeks. In a patient with a known intrauterine pregnancy following an IVF, what finding warrants investigation for heterotopic pregnancy? Also, the heterotopic pregnancy is very, very rare, but the heterotopic pregnancies are more common in IVF than a natural pregnancy. So, it occurs in 1 to 100 pregnancies from the assisted reproductive technology. So, it is more common. So, if there is a confirmed intrauterine pregnancy, and a patient presents with persistent pelvic pain or an adnexal mass, we need to follow up, or we need to rule out any heterotopic pregnancy. What first trimester ultrasound finding is a marker for increased risk of trisomy 21 and cardiac defects? So we need to pay attention on this one. Risk of trisomy 21 and cardiac defects. So it is the tricuspid regurgitation. It's not nuchal translucency because it's not only T21. So tricuspid regurgitation in the first trimester is found in 50% of the trisomy fetuses, and also increases the risk for major congenital heart disease even if the karyotyping is normal. Which fetal position is mandatory for valid nuchal translucency measurement? Neutral position. The head shouldn't be super flexed or super extended, so it should align with the spine. A woman presents with a subchorionic hematoma involving more than 50% of the gestational sac circumference. What will be the clinical implication in such case? So in such cases, if it involves more than 50% of the gestational sac, there are heavy chances of miscarriage or pregnancy loss. So what do you mean by the ultrasound appearance of the interstitial line sign? It is a thin echogenic line extending from the endometrial canal to the ectopic sac. This sign is highly sensitive and specific for diagnosing an interstitial ectopic pregnancy, and it represents the interstitial portion of the fallopian tube. So interstitial line is the thin echogenic line from the endometrial canal to the ectopic sac. Threshold for fetal megacystis in the first trimester. If the longicystis is the bladder, so mega means enlarged. So what is the cutoff? That the longitudinal bladder diameter is equal to or more than 7 millimeters. There are high chances of chromosomal abnormalities like trisomy 13 and 18. And if it is more than 15 millimeters, it's strongly associated with the urethral obstruction as well, posterior urethral walls. So this is all we learned about the obstetric ultrasound and fetal observations in the ultrasound. So follow along, like and subscribe, and see you in the next video. Bye.